Hello everybody, my name is Lucy Potter and I will be telling you today with my colleague Michelle Farr about our open research Bridging Gaps, which is about improving access to primary care with women who've experienced severe and multiple disadvantage. So people with severe and multiple disadvantage might experience combinations of homelessness, substance misuse, street sex work, domestic violence, sexual violence. And you can imagine that any one of these factors can have a really profound impact on your health. Now imagine the situation that 2 or 3 or more of these are affecting you. People with severe and multiple disadvantage experience much higher mortality and morbidity. Mortality rates of 12 times for women who experience SMD and 8 times for men who experience SMD. They experience that despite being a relatively young population, they experience the multimorbidity and frailty equivalent to over 85-year-olds. These inequalities are devastating and widening through the pandemic. So Bridging Gaps is a co-production project between a diverse group of women who've experienced SMD, 125, a charity for some of Bristol's most marginalised women, University of Bristol researchers, GPs and trainee GPs. So I'm a GP with the Homeless Health Service and I have been doing that for the last 4 years, and as part of that I deliver an outreach clinic at 125 for street sex working women. And it's been really evident through both of my clinical work and the feedback from our co-production team that's come through, there's a really high level of unmet health needs, that people often experience stigma, discrimination, and can find it really difficult and re-traumatizing to have to share difficult experiences at a GP surgery where they may not have any kind of continuous relationship or trusting relationship with a professional. So the aim of our project was to improve access to primary care for people with severe and multiple disadvantage. And to achieve that, we've been working with GP practices and people with lived experience.
So what have we done through the project? So we've been working together for 3 years and we've been pioneering inclusive open research methods with a highly marginalised group of women. We've worked with this group of women with severe and multiple disadvantage to initiate and develop the Bridging Gaps project together. And we've tried to share decision making at every stage. And through the years of the project, we've involved 25 women with lived experience of severe and multiple disadvantage and 18 professionals who have contributed to the project. So some of that has taken place during the pandemic, and we managed to meet every 2 weeks through the pandemic. Initially, not everyone had access to the technology to meet online, so we needed to make sure that people get the IT equipment that they needed. So this involved actually setting up a new process within the university, as this hadn't been done before. At times though, we still needed to pause the meetings to keep everybody safe. The other major challenge through the pandemic has been actually working with busy GP practices, because they've had a massive role in the whole vaccination programme. And so we've needed an open and flexible approach to engage with people. So through the time we've been together, we've developed a training course looking at trauma-informed and improving access to primary care. We've run this with 5 different GP practices. We've co-designed a new open access clinic for people with severe and multiple disadvantage. It's called Open Doors Clinic within Wellspring GP practice. And we've worked with other GP practices as well to improve their access to people with severe and multiple disadvantage. We've also engaged with much more high profile advocacy at national and also international levels, and have co-presented with women with lived experience of severe and multiple disadvantage at national conferences, an international conference online that was held within Japan, and hopefully later on in this year, myself and another member of the group with lived experiences are going to Canada to present our work there. So some of the women have shared some of their kind of experiences of what it's been like to be involved in Bridging Gaps. And one of the quotes I'm just going to read out here is from one of those women who's been involved from the beginning. I've really enjoyed working with Bridging Gaps. We are a group of diverse women. working with Bridging Gaps has given me a real sense of pride and fulfillment to actually see changes happening because of such amazing and strong women is fantastic. Working with GPs to be more trauma informed in services is such a vital part of supporting women who have been through so much in their lives. So the group have been first authors of a chapter sharing their experiences of working in co-production through the pandemic, and that's available online to anybody to download. We've designed and delivered training on co-production for the National Institute for Health Research School for Primary Care Research. We're also in the process of writing 2 open access articles to share our learning. And we're going to be developing web resources and training for people who want to work with marginalised communities within participatory research. And we're also working with a health system lead to apply this work to other areas and work with other marginalised groups. So I'm going to leave the presentation with one of the quotes from one of the GPs who's been involved in the project, who said, "We've really appreciated working with Bridging Gaps team. It's so helpful to have their energy and enthusiasm. They have challenged us and encouraged us to think in different ways. And I feel so lucky that we've been able to put the ideas we have developed with them into action. Now that we have started to run the Open Doors clinic inspired by the women's ideas, we are seeing how many people had health needs which we were not meeting and we had not even realised about. We would really like other people to share our learning and patients and other practices to benefit from it." And I'll hand over to Lucy for the last slide.
So I'd like to thank everyone who has contributed to the Bridging Gaps project throughout. So that includes women with lived experience and 125 staff. Additionally, all the GP trainees and GP practices have been involved in the project and the training. And thank you to the various funders that we've outlined that's enabled us to do this work. Thank you very much.
Thank you.